welcome to the second ever PR UK podcast, Pruk Pod, and delighted to be joined by a special guest for this second podcast. So I'll do quick introductions and then we'll get straight into it, because I think we've got some interesting things to cover in this one. Hopefully that'll be useful for people thinking about applying for a grant from PR UK. So just do some quick introductions to start with. So I'm Guy Parker, Chief Executive of Pharmacy Research UK. Desh, do you want to go, and then Adam, do you want to come in next?
Sure. So I'm Desh. I'm the Research Manager for PR UK.
Hi everyone, my name is Adam Todd. I'm Chair of the Scientific Advisory Panel for Pharmacy Research UK, and also an academic in the School of Pharmacy at Newcastle University.
Brilliant, thank you. Well, yeah, we're particularly pleased to have Adam with us for this one, because ultimately Adam is the sort of the Scientific Advisory Panel is the body that assess all of our applications, the kind of group of very experienced academics who will be able to look at different aspects of all the applications that come into us, and that, along with the peer review that we have done for all of our applications, is what we use to kind of assess and decide essentially which applications should receive funding. And as chair of the panel, Adam probably sees more applications than most people have hot dinners, so is very well placed to give a bit of a steer as to kind of what we look for and what makes a difference when an application comes in, and what are the common pitfalls, I guess, as well as the common things to really look out for and do. Now, I don't know, Desh, if you want to kick off with any kind of particular thoughts or comments or questions. Do you want to start us off?
Yeah, I'll start off. Well, thanks again to Adam for joining. I think this is an important podcast for a couple of reasons. First of all, the feedback that we tend to get from the applicants who apply to us and researchers is firstly just how brutal the process can be, because it is very competitive, particularly for PR UK, because we do have a relatively limited budget. There's only so many proposals that we can fund, and given the amount of applications we get in, it's reasonable, but still it means only really the best proposals can be funded. We want to ensure that we get the most for our money in terms of the quality and the value that the proposal can offer. And I know we're going to speak a bit more to that, and Adam has some thoughts on that as well, I'm sure. But another reason it's important is because we're going to go through and I've put down together some of the most common feedback points that we tend to give for applicants who are rejected, so who do not get the funding from us. And I was just speaking to Adam before we hit record. There seems to be such a focus on, who gets the funding, and we put it on our website, and these are the projects we funded. And Adam mentioned around the fact that we don't really speak about those who have been rejected and what those applicants and researchers can do to help support their bid for next time. So that's why I think this will be a very interesting discussion. So Adam, I was gonna riff off some feedback points that we typically give to applicants who are rejected, and I'd be keen to get your thoughts on it. So I'll start with the first one, and I'm reading from previous feedback that we've offered. So the proposal was over ambitious, and it was unclear how the proposal could be delivered in the time frame, particularly with the different work packages included. So that was an example of a feedback point that we gave last year to an applicant. I'm curious about your thoughts on that one. The proposal was overambitious.
Yeah, so thanks, Desh, and I'm pleased you've mentioned this one. And I think if I had a list, of the most common pitfalls that we see on the panel, this would be absolutely at the top. So I think it's really important that we acknowledge that the type of research Pharmacy Research UK can fund, and I think we're looking really to support people in their research journey, in terms of give them that initial step up to accessing some research funding, to maybe think about doing some preliminary research, some pilot research, to see what they can do in terms of developing a research question for more of a longer term piece of research. So I think it's really important that applicants don't overpromise that what they want to do. I think again on the panel, we're absolutely looking for high quality research, but also we want to be confident that that research is deliverable in the time and the budget and the resources that that project has. So that's the key thing. So I think people almost want, or think the panel want to see a lot of overpromise, doing a lot of things, getting that value of money. But the reality is that that really proves a risk. So what we want is a sensibly costed piece of research that will be achievable in a sensible time frame. And again, I think the next question is, well, what does that look like? And I think my advice really is to talk to academics who maybe you're working with, maybe might be involved in the project, maybe supervising a particular project, and ask them in terms of what is sensible and what is achievable in a certain time frame. Because again, if something is over ambitious, it might be really well developed and set out and achievable, but if we don't think it's achievable to do in that particular period of time, it's not going to be funded. So that's really important.
Yeah,
but just to give you an example of things that we see, that things like somebody maybe doing a systematic review in a month, or maybe doing a qualitative project again in 6 months, doing that part-time. And these are just some examples where really that's just not achievable. That wouldn't be achievable for a really experienced researcher. So it's not something we really want to encourage or fund through PR UK.
Right. That's really helpful, particularly around the budget that our particular budget, where it's not as vast as, let's say, the NIHR, the RFPB program, for example, where perhaps you would expect kind of more robust package of work to be delivered over a longer period of time.
Yeah. Our
research is over typically 1 or 2 years, so they have to be limited. So I guess then, is it more the mindset of the value? Is it like, well, if I'm showing that I'm going to be doing all these things, then surely it's going to look impressive, but in fact it kind of does the opposite. It's too much, right?
Yeah, it goes the other way. So I think if you've got multiple work packages, lots of different complex approaches, or you may be thinking about an intervention feasibility study around an intervention, anything like that. There are funding streams there to fund those things properly, I suppose. And again, if you're thinking about developing some sort of intervention and then evaluating that intervention as part of a feasibility study and then a definitive trial, there's those things tend to cost anywhere between hundreds of thousands of pounds to sometimes millions. And that's not something that we tend to fund in PR UK. Ultimately, we'd like to do that, but that's not really what our mission is. So it's about maybe taking a step back and thinking, okay, I've got this time. What could I do in this period of time that would maybe address an important question? But actually, what we're also interested in is, after that question has been addressed, what is the next step? What is the next step? And if we could act as a springboard to apply for further funding, I think that's what we're really interested in doing. And I think the other thing is, again, Pharmacy Research UK, we're very interested in the project and funding projects to address questions, but we're also very interested in funding people. And I think that's a really important message to convey. It's really about the person and what are they going to be doing with this research and how is this going to support their development.
Yeah, thanks, Adam. That's a great point. And it actually ties together really nicely, because if you can put together a proposal that just focuses on one aspect or a couple aspects of the work that is realistic within the funding envelope that PR UK provide. One of the other things we're interested in as a funder is, okay, where are you going to take this in the future? How is your research direction going to go? And like you said, using the funding you get from PR UK as a springboard for further funding. That's our purpose. Having funding that, and we've had it in the past where researchers have been funded by us have gone on to get NIHR, RFPB funding, program grant funding. That's exactly our purpose in place. So yeah, that's really interesting. Well, that moves us on to the next point, which is that there were concerns and uncertainties around the study design. There were unclear aims and objectives, insufficient detail in the study design, and so it was not possible to provide a full or fair assessment given there was a lack of detail. There's also feedback that we provided of the questioning the relevance of the research methods and study design and how it would not sufficiently address the aims and objectives of that proposal. I know this is a big one, and there's so many areas I guess this section could go wrong. I'm just curious about your initial thoughts on that. What do you think is the biggest downfall in terms of applicants typically getting that section wrong? What could they do to strengthen that bit?
So I think I'd probably break that up into two main areas. And again, I think it is a big section. I think at the beginning of a research proposal, really what you need to do is state what question you're interested in answering. So what is your research question? So I think, people are very comfortable in writing about a research area, whatever that is, maybe, I don't know, diabetes, public health, cancer, whatever that is. But actually, what is the question? So furthering that in, what is the question that you want to address is part of your topic or discipline. And then once you've identified the question, you then need to develop or articulate a method for how you will successfully address that question. And that's the key thing. So you've got to state your question, and you need a method that will be able to answer that particular question. Because often we see questions stated and the methods employed or the methods stated that will be used, we know will not be able to address that question.
Right.
So those two things need to match. Will your methods address your question? And again, talk to experienced colleagues, talk to supervisors, talk to academics. There's also the NIHR Research Support Service.
Mm-hmm.
They should be able to help with those sorts of things. And then I think the next one, as part of that, is just being consistent in what you write on the application. And again, I think at PRUK we are fairly generous in terms of the space you can write on the form. There's a lot of space to write, and to be honest, that's a good thing, but it's also a bad thing as well, because I think sometimes people feel compelled to fill up all the space on the form. So some projects, absolutely be very detailed, and you will need to use all of the space. Some you won't, for example. It just depends on the nature of the project. But I do think once people start to write, and maybe they get a bit lost in the writing, that they might start to then deviate from the question. So they might have a certain question at the beginning, and then they might introduce maybe a second question or an additional question, and I think that's then very difficult, because when you're trying to judge the research proposal, one of the things we look at is the question clear, and are we confident that the methods and also the team will be able to address that question? But if it's not clear what the question is, we then can't really think about the second step in terms of other methods appropriate. So I think it's about being really clear, writing really concisely, and also sometimes it might feel as though that, I'm not really sure what this section is wanting me to write. Maybe I've just written about that in the other section. Maybe there's a bit of duplication, but actually that's okay, because it shows that your approach is consistent. So you've got that consistent thread going through the application. What's really difficult is if you've got different questions and different methods and different aims, and it just all doesn't hang together. So that's really important.
Yeah, that's a very good point, and very interesting, because I hadn't really considered it like that before, and I'm not sure about researchers or the pharmacy professionals who apply to us, whether they, like you said, the design and the research method you have is dependent on the question you're trying to answer. So you've got to be very clear what that is. And to me, it's like, okay, maybe don't get so bogged down then in each individual section, but rather think of the application as a whole. What is the story you're telling? What's the background to the problem? That's going to naturally lead you to what question you want to answer. And that question you answer is going to determine what method you employ, rather than, oh, this is the design section, I've got 2,000 words. Okay, well, I've got to, and it can be easier, I guess, then to perhaps over explain or start adding in things that weren't necessary, and they may even potentially conflict with what you'd said in the previous section. So I guess from what I understand you're saying, Adam, is what's good about PRUK, you've got the space to write it. So provide the detail, but at the same time, be concise and make it flow throughout the proposal.
Yeah, I mean, another thing is, when we assess the applications, as a whole. It's not like an exam where we mark the certain sections out of a certain mark. So and I would also say that people that sit on the scientific advisory panel are incredibly supportive. They want to fund good quality research. We all do. And they will absolutely give people and applicants the benefit of the doubt. So if something's covered, you're thinking, well, actually, this should be covered in this section, but it's actually covered down here. That's okay. We give people the benefit of the doubt. We don't say, well, that should have been covered here, so we can't consider it. But it's just when we start to get variation between the two, or it's not clear, that's where we start to again lose confidence in the application.
Yeah. Okay. That's very helpful. So for the listeners who are tuning in, that's a really important point. Just provide your application as a whole. And just to add to that, we have patient representatives who sit on our panel. They are not, researchers. They're not experts. They are members of the public. So it has to make sense in terms of what the problem is and what approach is going to be taken to solve that problem. And obviously we have scientific members like Adam who can understand the nuances and the relevance of the methods, but each section has to fit into the wider picture. So that's really helpful. Well, the final point I wanted to get your thoughts on is around dissemination. So I'd read a blog post that Professor David Wright from the University of Leicester wrote for us around he called it the message in a bottle, which is typically in the past, it's very much you list down where you're going to disseminate your research findings, but actually dissemination seems to be much more than that. It has to be integrated from the outset. So if you're planning to present your findings to a particular patient population or group, have them involved from the outset so you can craft your findings and produce outputs that are going to be tangible and impactful. So just your thoughts on dissemination, and I guess it feeds into that narrative of it's all part of the bigger picture.
Yeah, it does. And I couldn't have probably put that better myself in terms of it's important that the dissemination is really integrated into the overall plan of the work. It can't just be an afterthought in terms of, well, we've done this, now what should we do? And I think it's important to think about the different types of dissemination we can have, and we can have very much, academic, maybe practice-based dissemination. So thinking about, I'm going to write this research up into a scientific paper, and then I'm going to publish that paper, and that's great. I'm going to present this work at a conference. Again, that tends to be more of a traditional academic output, and I think that's also good. But I think what we're interested in is the dissemination as a whole. So, as you mentioned, we've got patients in the general public on the panel, and again, very much interested in the dissemination. So if you're, interested in doing research with a particular patient group, for example, how might you disseminate your findings to that patient group? Because, I'm pretty clear, the majority of those won't be reading an open access scientific journal. So I think you've got to think a little bit outside of the box for that. And, we see some great examples. We see people having podcasts, a bit like this with patients, and, they might ask what patients or what people think about the results, think about the study, what does it mean for them, for their care, what they might do in the future. And again, there's lots of really good examples of active dissemination. But again, I think that's thinking about the grant as a whole and having that longer term plan in terms of what does this particular research project mean for you, and and your career and your research, I suppose, research trajectory, and the dissemination can really inform the next thing you want to do. So I think that's important. And again, I think another thing is, we're interested in dissemination, obviously about the research, but also about people's experiences of doing research as well. And that's a potentially another thing that could be disseminated, because look, research is really difficult, and all research projects are different, and all will have unique challenges and also opportunities. But what I will say is, from you submitting that grant to PR UK, something will change, or something will happen that you're not expecting to happen, and you will have to kind of navigate that. And that's been my experience with every single research project I've been involved in. And sometimes that can feel a little bit strange, a little bit uneasy. Sometimes you can worry, what will the funder think? And I think finding out about people's reflections and what they thought and what they did and what they learned from the process, I think is also valuable.
Yeah, absolutely. And it kind of adds to the issue that I know when I've spoken to researchers, and I'm sure, Guy, you've kind of noticed this too, is the competitiveness of the process of applying for research funding. It's probably not so much noticeable with PR UK, but certainly with NIHR and other funders, it's very competitive. And given that we can only fund a certain amount of researchers, I guess, Adam, what would you say is the ideal time that a researcher needs to really develop their bid? It will depend on what they're doing. It will depend on the nature of the call, but how much time ideally is needed? And because you've got to have these conversations ahead of time with your team.
Yeah, and I think there's probably two. So I've probably been involved in two kinds of projects. I've been involved in very, very planned projects. So we know when the funding calls are available, and those things, I say generally, published in good time. So that's really positive. And so those kind of planned projects where we think about it, we think about the team, we think about the method, we'll draft something, we will refine that, we will involve our patient and public colleagues, we'll involve them right from the beginning. We might present a project idea to maybe a PPI group or something like that, and that takes a lot of time. So I think that type of project takes anywhere between 6 months and 12 months to put together. So it takes a long time. It takes a lot of effort. But again, my experience is when those types of projects are put together, the chances of funding are generally quite high. It's not guaranteed, because sometimes your project will be fundable but not funded. And that's really frustrating in the sense you haven't, ranked high enough. But it does happen. But again, I think you can control how prepared you are for your project. It's only between 6 and 12 months. The other type of project that I've been involved in is a project where there's a call very last minute, and you think, oh, there's something in a month's time or 3 weeks' time or whatever. Oh, I feel compelled. I need to apply for that. Let's put something together. And those things tend not to work very well. Again, I don't think I've really been successful in those types of projects. I think they're very rushed, and you don't have time to really think about it properly. You don't have a lot of time to think about the team, and again, involving patients and general public at the beginning, and all of those sorts of things. So I think my advice for that type of project is don't do it. You're far better on holding on to that project and developing it, because ultimately, that's when we get into that. It's too ambitious. This method won't address this question. You haven't thought about dissemination properly. It takes a lot of effort to put together a research project. So this kind of last minute, I would be saying no.
Yeah, absolutely. Well, no, there's a very good point. And we do see applications that come in at the last minute and the panel know it's too rushed.
And I think, if I'm honest, if we are assessing these applications, it's really obvious which ones have been put together at the last minute and which ones have really been thought through and reviewed. It is really obvious.
Yeah, absolutely. And another thing that you'd mentioned before, which I found very interesting, is around perseverance. I know I've spoken to researchers who have been discouraged from the feedback. They've been upset by the feedback we provided, the fact that, obviously there's so much work that they put into it, but for a certain amount of reasons, it just hadn't made the cut. And I know, Adam, you mentioned around persevering, and you had a student who'd had that experience. Would you mind sharing a bit about that? Because I think it's such an important message for those who are listening to hear this.
Yeah, and I think this is something that we tend to do not very well. So first of all, I think everybody on the panel is, as I've said, is super supportive, and we want to fund as many projects as we can. It's great in a panel meeting when you've got a lot of high quality projects to discuss and review. That's a great thing, and that's absolutely what we want to do. So we don't enjoy not funding research. So just like make that really clear.
Yeah.
So that's that. But occasionally, we won't fund a piece of research. The other thing I should say is we won't fund a piece of research because, we like the idea, but potentially like the method's wrong, or, everything has to be right. So I think with that in mind, we sometimes say no, or sometimes we'll say, this is what we think could be improved, but we'd like to see an application next year. We would encourage you to apply again. But I think it's that perseverance. And I think, again, in the research game, we tend to celebrate our success, which is really important. So we have some success, so we get a grant, or we publish a paper, or we do something really cool. We need to celebrate it. And that is very important, because a lot of the times, we don't get the grant, or we get the paper rejected, or something doesn't happen how we want it to happen. And those things, unfortunately, are really common in research. And I know, Desh, we were just talking before we started the recording button, and I've literally just had an email through saying I've had a grant rejected, literally just 10 minutes ago. So, and that's really difficult. And I think when you first start off, that can really hurt, because really the research project, it's your thing. It's something that you've developed and you're really embedded in it, and it's very personal to you. And then to get some feedback saying, actually, this is what's wrong with this, I think it can be really hard. So again, my advice is you need to have that skill. You need to be able to take criticism. You need to accept, actually, maybe this wasn't good enough, but actually, how do I improve it? So I think if somebody's saying no, I'll be asking, well, actually, how do I make it better?
Yeah.
And I would persevere, because again, I think what we don't share those failures. It happens all the time, but we don't, start going on social media saying, hey, I've just got another grant rejected, isn't this fabulous? We tend not to do. We tend to just delete the email and not think about it. So I think, again, my advice is really, it comes back to the personal development and the support the person has around the wider team. Again, talk to supervisors, talk to colleagues who are more experienced in research, and ask about their experiences about rejection, because everybody will have their own story. And I think, so it's not personal. I think it's difficult. I think you need to think about, what could I learn from it? You need to reflect on it. Actually, what have I learned from this process? And go again. That's really important.
Yeah. Well, Guy.
Yeah, and I was just going to say, and I guess the other thing, just to add from a PR UK perspective, is that obviously the feedback we give, and we do tend to try and not just sort of say, no, that's it. We try and give feedback and explain the decision and give a bit of kind of a sense of what the panel felt. And sometimes that can be harder, where it's just kind of, two good projects and we could only fund one of them. It's fine margins sometimes. But I guess the feedback is always, it's intended to help, to provide that a bit of advice. It's there as a mechanism to try and give that bit of extra information and advice and support for the people who've applied. It's not meant to kind of, you know, demoralize or upset. It's, yeah, the aim is to try and be supportive. So I guess it's, yeah, if you can get over that the obvious disappointment and try and view it in that context, that it's intended to try and support and make the application, you know, even better the next time. Here are what are the things that could have boosted it up and, you know, got it just over the line for the next time.
Yeah, yeah. Well, the feedback that we offer tends to be twofold when we, you know, have to reject an applicant, which is the first one is what was identified as being wrong or not ideal in the proposal. But then there's the flip side of that, which is where we're kind of suggesting consider doing this for next time, or consider addressing this ahead of a future bid. So we do try and make it very encouraging, and that's a benefit we have of being a small funder. So we're not responding to hundreds of applications where we're limited to 3 points, which I've had that experience before. We said, look, what was everything the panel said about this? Let's put it in. Let's give them as much information as we can. And I think perhaps a good point for us to finish on this podcast is, from my perspective, is really read the guidance that accompanies the application form, because often in there is providing much more information about what question we're asking, what the panel want to know from this question. So by reading the guidance, you get to structure your answer and your response based on what the panel would like to know. And I think that can also make a big difference when it comes to developing your proposal, because you are providing the information that the panel are after. And that could avoid having the feedback of, you know, the application was not clear or there's not enough detail. So there is a skill in that of providing enough detail, but being concise, being relevant, and like Adam said, making it all connect together. Well, I think this was very interesting. I don't know if Guy or Adam, if you had anything to add on this topic. I mean,
yeah, I suppose I've just got one. I suppose it's a positive to finish on. In that, one of the things that's really nice about being on the panel is you certainly do remember applications, because it's a lot of work to read them, review them, think about the reviews, comments. Then you've got to then present that application at the meeting and then discuss it. So you do kind of remember them. And as I said, there's occasionally where we might decide not to fund a particular project and give them feedback. And what's really nice is if that feedback's then considered and taken on board, and then the next panel, we discuss it and then we fund it. I think that does happen, and I think that's really positive, and we really like to see that.
Yeah, that's a good point. And again, it's something that's not spoken about.
It's true, and I guess it's been really interesting, just kind of listening to the conversation. And I guess a lot of it, there's a few common threads, aren't there? A lot of it is about getting that kind of coherent, focused, and really kind of thought through project, because I guess essentially that's what we're looking for, isn't it? It's not necessarily the biggest project, it's the one that is that you feels like it's a quality piece of research, targeted, focused, and consistent. And if you can build that kind of across the application, my sense is that's essentially what the panel is looking for. It's that coherence and the quality and the consistency.
Absolutely. I know from experience that we had funded an application, but we asked them to remove 2 work packages. And we just said, split the project, make it a smaller project, and we will fund it. So it adds to the value of, don't promise the world, just have a realistic timeline, and also don't underestimate just how long things like recruitment can take and how many people will attend. These are the small things that you need to pay attention to.
Brilliant.
Yeah,
that was so helpful and so interesting. So thanks very much, both of you guys, and particularly thanks, Adam, for taking your time to kind of talk through the process, because I know obviously you're many other things on, such as reviewing your application feedback that you received during the meeting. But it's been so interesting, and hopefully for people applying, I guess it's a competitive process, because we can't fund that many, awards, but hopefully we try and make it a kind of a supportive process. And I guess, yeah, I hope that's come across through this discussion, that we want to receive as many applications as possible, and we want to support the applicants to give the best possible outcome that they can. So yeah, hopefully there's a few tips on how you might improve your chances of success. So through this, really brilliant. Thanks very much, both of you.
Yeah, thank you, Adam. We appreciate your time.
My pleasure.
Brilliant. And I guess